Now we hear about AI. Future baby would never have cavities. I hope we can learn how to grow new teeth, face shape, elongated face. Now we can fix the sleep apnea from birth and up. We're doing bone grafting. We're doing different type of approaches which were not accessible just 5 years ago. But the goal would be to predict the future.
Welcome to the Ask the Dentist podcast with Dr. Olga Dolghier, where your smile meets your overall health.
What is the future for dentistry in general? Now we hear about AI. AI is taking the world. We're all going to be jobless in future, 20 years. So what about us? As a dental professional, I'm very concerned. I love my job. I like to help people, and we don't want to lose our specialty. But I think we're going to be okay. But I think we're going to transform to a completely different specialty. How I see dentistry in the future, I see it as a part of medical profession which concentrates on lifestyle, concentrates of genetics, concentrates of biome of the mouth and body. So it's going to be completely different, submerging, and also probably surgery will be integrated with orthodontics. So I see a little kid, which we see little infants who are newborn, who cannot suck. And I think that's where we need to start, maybe even with pregnant mothers. At that point, with a pregnant mom, I can identify her biome. I can identify what type of genetic material she carries. Does she have a gene which makes her high risk for decay? What is her diet is like? Is she consuming enough vitamins? Is she consuming enough minerals? And now I see my first patient, brand new baby, with a beautiful smile on the mom's face, who struggles to nurse. As a future dentist, I'll be able to assess this baby, take probably swab to determine what type of bacteria do they have. Most likely they're new. They don't have that many different bacteria, but we definitely want to promote the nursing and breastfeeding. What kind of facial features does he have? Does he have restrictions? And we're already in this future to a certain extent. Now we help the baby nurse. Now mom is giving them the best nutrition she does custom-made formula for the baby because that milk from that mother is made for this particular baby. How amazing that is already. So when this little child grows, now we're going to support his good nutrition, which would be very important. We will double check and triple check his biome in making sure that we have optimum probiotics, prebiotics to optimize his gut health and oral health. And now we know if he does carry that gene, maybe we'll have gene therapy at that point, which a lot of controversy with that as well, but maybe it would be safe and we will modify the gene that this future baby would never have cavities, would not have genetical predisposition. We will have amazing robotic structure which can check fluoride levels on every single level. How much fluoride do we have in water? Natural sources of water, because water may have natural fluoride. We'll make sure it's optimized. And if that child, when we take some type of digital non-X-ray radiation images, which would be future, AI will create some type of imaging without X-ray, without radiation, I hope, because radiation should go away at that point, maybe not. And now we know how they're developing. We'll see if they potentially have wisdom teeth formation in the wrong spot, or they have extra teeth, or they have pathology, and everything we can probably do with robotic surgery before the problem starts. We already can prevent the disease. We already can do surgery without when now actually they developing new technology when they do wisdom tooth removal in a stage when it's just tooth bud. It's not even a tooth, it's just a little tooth bud. They already have technology to remove those tooth buds. So that would be part. And orthodontics, if you do carry the genes, well, in the future we have genes, right? We're all perfect genetically, which is complicated to do. Now, if you do have a crowding facial features, if you have that British origin with constricted or dolichocephalic tooth, face shape, elongated face, now we can fix the sleep apnea from birth and up. We can put different appliances, make the wider jaw before the age of 1, before the age of 7. Now we don't need orthodontics. Technically, if we can fix everything, we don't need, the child would be already corrected. And I see that how would be beneficial, because we can correct deficiency with the helmets when they're 1-year-old or under the age of 1. Why can't we correct the facial deficiency on younger kids when they're very young and direct the growth? Because, well, growing gonna be changing, the jaw gonna expand, everything gonna be changing, but we're gonna guiding it all. So that's how I see it. And maybe orthodontics, if we still need it, it would be completely digital, and we would do some type of expanders or different type of clear retainers. But the goal would be to predict the future and see if this, back to that little infant, if he already carried the genes, or you screen the parents and they both have some type of malcrowding, or they have bad bite, and we all can change and predict this so early that at the age of, 7, we already know how they're gonna look like, and now we're just directing them to the right path. With adults, I hope we can learn how to grow new teeth. That would be amazing. And finally decipher that biome with 700 bacteria and know the way to alternate it to optimum level, that we don't have cavities. So that's the future. That's how I see it. It's very futuristic. Also, I think it would be amazing to have dental centers, which would be kind of a pediatric center, that we have all the pediatric specialty together, that we don't need to send you to this office, to that office. And we would integrate also the positive, like chiropractic, manual therapy, myofunctional therapy, everything at the same time, so that little kid, prevention would be the key. So technically, when we see them at the age of 1, we already did so much that we just kind of direct their future in making sure now no more fast food restaurants, right? In the future, now we have this organic, farms growing on the top of the tall building, and we are completely providing the best nutrition, and that's ideal future, which kind of sounds very, very beautiful, and that's what we hope for. We hope that we can change the way dentistry is developing, and from drilling and filling, we are more preventative doctor who cares overall about the whole picture, about biome, about genetics, about skeletal features, about airway at the same time. That way we're preventing disease before it ever begins. That's how I envision the future of pediatric dentistry. Current trends for the future. Well, now we're introducing AI in reading x-rays. It's still not ideal, but we're more accurate in detecting decay. For example, if we have multi-doctor practice and all of us have different eyes, so sometimes one doctor see something, the other one didn't see it. Now with introduction of AI, we will for sure make sure that we do not miss certain situation which can be hidden decay. So AI definitely help us with reading x-rays. Orthodontics, what new current trends, we're kind of stepping out from analog orthodontics, which is wires and brackets, to digital orthodontics, which is more clear retainers, expansion with clear retainers, computerized, guided growth and development. So that's where we're moving towards. Oral surgery, again, now we have 3D imaging, very, very advanced and precise placement of implants. That's definitely future and advanced technology. Also, we're doing bone grafting. We're doing different type of approaches which were not accessible just 5 years ago. So we're now screening for certain type of pathological bacteria, which actually we know that certain bacteria cause periodontal disease, and we can be preventatively screening early everybody and actually eliminating this bacteria before problem begin. So that's what the trends are. Technically, it's digital technology, laser becoming more and more accessible, soft tissue laser, hopefully hard tissue laser in the future. Hard tissue lasers exist, but it's still kind of not as efficient because a lot of times we still have to use high-speed drill technically to prep the final prep for the cavity. So laser, digital technology, new surgical approach, more precise diagnosis, biofilm screening, determining what we're missing. And also I think the future would be amazing to do for dentists actually blood work to determine certain type of inflammatory factors, deficiency of minerals, deficiency of vitamins, because believe it or not, now in 2025, we see vitamin C deficiency. It's scurvy, guys. That's what sailors had back in 200 years ago. That's crazy. So, nutritional balance, nutritional analysis. So that's all in the future, and that's all current trends. So I hope it helps, and the future is the brightest. So if you like this format I'm creating, if you like these bright ideas and you want to share with me how do you see the future of dentistry, what bothers you and what do you want me to talk about, please share this podcast with others. Subscribe for my podcast because I want to create more. I truly want to have a good connection between oral health and overall health. And I wish you healthy, beautiful smile.
Welcome to the Ask the Dentist podcast with Dr. Olga Dolghier, where your smile meets your overall health.